Yeah. Okay.
Okay. It's started.
Hi, everyone. We're just about to kick off and start this session. Welcome. Welcome to the Instagram Live. Hi, guys. Thank you so much for joining. Definitely timekeepers there. Well done. Hi, Super Mamas. Thank you so much for joining on time. Well done. Thank you. Thank you so much for joining. We will be going through breastfeeding, which is a topic I'm super passionate about. On how to ensure that moms are not struggling with breastfeeding, because sometimes it's difficult. Sometimes it's very hard and you shouldn't be suffering. If you're suffering, then there's something wrong that needs to be changed. So please just stay tuned for the hour. I promise you, you're going to learn a lot. Thank you, guys. Thank you so much for joining. This is so exciting. Good. Thank you for the waves. I can see them. Welcome, Yummy Mommy. She sent a request. Hi, welcome.
Hey!
Hello.
How are you doing?
I'm good. Don't you look so pretty?
Oh, thank you. I got all dolled up just for these. Yanni, I was just like, it's a Saturday afternoon. We gotta
I
look
know.
cute. We gotta look cute. How you
You
doing?
too. I'm well.
I
Excited
haven't
to
seen
be able to be here to help moms go through this breastfeeding journey, flawlessly and
Absolutely.
without
I
any
know.
mishap.
Yeah, welcome everybody who's joining. Hi, everybody. Welcome. Oh, we have such a good number of people. Guys, let us know where you're tuning in from. Send us any questions and we'll try to answer them as we go through the live. This is so exciting. Shiro, I haven't seen you in so long now that we haven't been going to church.
I know.
Yeah, I miss church. I
Yeah, but
really
I
miss
see you
church.
and I see you're doing good.
Ah, thank you.
Yeah.
And you'll be a bit disappointed when I tell you about my breastfeeding journey, which has ended very suddenly, but you know. Oh, okay. What's happening? Okay, fine. We're okay.
It has
All
ended
right.
suddenly.
It has ended suddenly, but we're going to talk about that first. Let's introduce ourselves first so that whoever is tuning in knows. I don't want us to assume that everyone knows who we are, so let us introduce ourselves first and then we can get into the discussion, right?
Yeah.
Okay, so guys, hi for everybody who's joining. I am Yummy Mommy. My actual names are Joanne Mooney, even though nobody cares about that name. Even my parents call me. I am a mother of 3 beautiful children. I have a 10-year-old called Ethan. I have a 2 and like almost 3-year-old called Mukeni, and I have a 5-month-old called Mutana. Guy, I have many children. Oh my god. Yeah. And Mother Baby invited me to be part of this session, which I was really, really excited about because I've spoken on my platform so many times about my own breastfeeding journey, which I will describe. It has been very eventful, very, very eventful. So I was really, really keen to be part of it. And I wanted to discuss with, I wanted to talk to Shiro because she's like, when it comes to knowing about breastfeeding, she's number one in Kenya in my books, honestly. So that is a bit about me. Shiro, you can introduce yourself.
Yes, thank you, Yummy Mommy. That's an amazing introduction. And yeah, 3 kids sound many, but imagine they're not many. They sound
You're
many when
right.
they're I mean, hi
Yeah.
guys. Really, we recognize that women have a hard time during pregnancy, during labor,
Yeah.
breastfeeding. education, by empowering them to ensure that they have an amazing and positive experience.
Yeah.
So I do this by conducting childbirth preparation classes. I also work as a doula. I do lactation support, complementary feeding, and most recently, I'm helping moms with trying to get a sleep routine going for them.
Wow.
So my name is Shiro Shera. I'm the founder of Nurturing Moms, and Nurturing Moms provides those 3 services or 4 or 5 that I've mentioned. I'm also a mom. I'm a mom to 2 children. I have an 8-year-old boy and a 6-year-old girl.
Oh, wow.
Passionate about breastfeeding, passionate about pregnancy and birth. And yeah, Nurturing Moms is your go-to place for all those things that you need support with.
Somebody just called me. Guys, if you're the one who's trying to call me, please don't call me. All right? Please, this disrespect, man. It's disrespect. Anyway, I wish there was a way I could put my phone on airplane mode, but I can't because obviously.
Oh, you can?
I can. No, if I do, then I won't have the net, then I won't be able to actually be on live. So now I can't even do that. Let's just hope nobody calls again. Anyway, guys, so I met Shiro a while ago when I had my second born, because she was trying to help me get to breastfeed that baby. So let me briefly explain my own breastfeeding journey, right? So I have my 3 children. I got my firstborn when I was at a very young age of 20 years old. I didn't know anything about breastfeeding. I didn't know anything about being a mother. I mean, I was living with my mom at the time, so you would expect that I would get a bit of guidance, but I honestly didn't know that much about what like breastfeeding was, how difficult it was. All I knew was that breastfeeding is something which comes naturally to mothers. So the baby is born, put the baby on your boob, and you're gonna be fine. Obviously, that did not work out. I ended up breastfeeding him for all of, I think, 2 months, and it just became too difficult. His mouth wasn't opening wide enough, so his latch was really shallow. I kept feeling really a lot of pain on my nipples. Eventually, I was just like, you know what, why am I struggling with this? Like, I was just like, no, I'm done. With my second born, which is the whole, like, 8 years later, which is 2 years ago, because she's almost 3 years now, I decided, okay, you know what, let me try and breastfeed. And I contracted the services of Shiro Shira over here. She came to my house, she showed me everything about breastfeeding, but I ended up not breastfeeding her for as long as I wanted to. But I think when I think back at it, it's just that I was lazy. In all honesty, I feel like I was lazy, especially because I was going back to work, and the whole process of like, I was starting a new job. So the whole process of like starting a new job, trying to pump, trying to, you know, breastfeed her when I get home. And then, you know, that how like immediately you go to work, it's like your boobs just know the supply started going down. I started getting really stressed about it. And because of that, because it was a new job, I just didn't want to jeopardize that. So I ended up not even, you know, continuing with my breastfeeding journey. Now with this last child, so this is my last born as far as I am concerned, you know, it's my last born, who is 5 months old. I felt like I really wanted to give breastfeeding a try. And for some reason, it came so easily to me this time. Like, I don't know whether it's that the confidence of being a third-time mom, or just feeling like, you know what, let me just give it a try, because I was very relaxed this time. You know, with your firstborn, you're like, this time I was very relaxed. I was just like, oh, you know, things are happening. So because of that, I think I was able to pretty easily breastfeed. Now, unfortunately, when I got to about 4 months, when the child was about 4 months, and she's 5 months now, I went back to work again. And with the going back to work, like my supply started diminishing. And honestly, let me tell you, Shiro, let me tell you something, Shiro. This whole thing of pumping is awesome, but it takes a lot of patience. And I just like, I really tried with the pumping. I really tried so that my supply doesn't go down. So at some point I was just like, okay, I don't know if I can do this anymore. So we had switched to now during the day when I'm at work, I don't breastfeed her. Then when I come home in the evening, like during the night, I breastfeed her. But like slowly, it just started going less and less milk. And eventually we just found that we have stopped. But actually, I was very proud of myself for being able to breastfeed even for those 4 months. Like, I was really happy.
You did really
Thank
good.
you. I really tried. Thank you. Now you tell, what has your breastfeeding journey been with your kids? Has it been, I feel like because you are a lactation specialist, it was easy, was it?
Imagine, it's been so amazing.
Yeah.
It was really amazing. And I think I would have another baby just to breastfeed. I love breastfeeding. Imagine that.
What?
I love to breastfeed. I love the bonding. I love the fact that I'm producing food for my baby, and it's just within my body I give them. I think because of the knowledge that I already had, I didn't struggle.
Yeah.
But I know many other moms struggle a lot. I'll tell you,
Yeah.
my son breastfed for 1 year and he decided I don't want anymore. And he just, he used to bite me. And I felt so
Oh.
bad. I used to feel, oh my God, he doesn't want me anymore. Because that's a special bond you have with your child. My daughter
Exactly.
breastfed until she was almost 2. And I'm already seeing moms asking here, how can I stop my 2-year-old from breastfeeding?
Exactly.
Imagine I stopped her because I had had enough. I had
You are
had enough.
tired?
Yeah. I'm like, I can't do this anymore.
You're
So
like,
I
no,
took
thank
cabbage.
you.
So those who are asking, I'd take cabbage and put it on my breast because I'd get engorged. And I'd feel, oh my God, she's there, she's crying for nyonyo. Imagine if I just put her, I'd feel so much better. But it just, I had reached the end and it's fine. As a mom, if you reached your end, just follow your decision. So I'd wear cabbage leaves and there are times I'm like, hey, yeah, why am I smelling cooked cabbage? Like, why am I smelling cooked cabbage? I'm forgetting there's cabbage in my breast. But cabbage does help. So it helps to slow down your production and it also slows milk production if you're engorged. But my breastfeeding journey has been amazing. So why I mentioned my daughter breastfeeding until she's 2 is that I still see a difference in their immunity. My son will get a flu.
Really?
And have a full-blown flu for 1 week. And hers, it's 2-3 days and she's good. And I attribute that to the fact that she was breastfed for longer.
Yeah.
So
Okay.
the benefits of continuing to breastfeed for as long as you want, even if it's 4 years, if you can hack it, why not?
Actually, my sister was my third born sister, because we are 4 girls. My third born sister was breastfed till she was 4. And like when I think about that, I'm like, a whole 4-year-old who can walk and talk is like coming to ask mommy for nyonyo. What? What?
No,
but I totally get that. Like in the short time, in the short time that I breastfed, I genuinely felt like I understood that serious bond that people have with their kids when you're able to breastfeed. And I kept feeling like, oh my God, am I going to be closer to this child than the others because I've breastfed this one and I didn't really breastfeed the other ones? It's like it's a huge thing. I think we have a lot to discuss, you guys, but let's shout out and answer a few questions that we've gotten. Hi, Tushi. Hi, Wairimo. Hi, Mombi. Wairimo. There's a lot of questions already about nipple confusion, how to stop breastfeeding. Someone is asking about nutrition and breastfeeding, pain, positioning. I think safe to say that breastfeeding is one of those things that like no matter how long we have been doing it as women, it's still something that we have not figured out completely, right? Yeah, I feel like let's start here. Shiro, like according to you, because you're an expert in breastfeeding, what is the secret? Is if there's a secret, what is the secret to being able to breastfeed and breastfeed effectively? That's my question.
Okay, there is a secret. The secret is this. Here's my little baby. The secret is this.
Does he have a name?
The names keep changing, so I won't even mention. So now, the secret to breastfeeding effectively is to ensure that your areola, which is this dark area, most of it is in the baby's mouth. Okay? So if you allow your baby just to suck over here, it's going to be painful and you're going to have cracked nipples. So you allow the baby to take most of that. So how do you do that? You wait for the baby's mouth to gape like they're about to yawn. So if they look like they're about to yawn, then you bring this baby quickly to the breast. But if you're too slow, they'll only latch on the nipple area, which becomes very painful. They start to use the breast as a straw. Oops, sorry. They start to use the
I hope
breast
that's not the baby. Okay.
No.
Okay.
And it becomes painful. So ladies, one of the things to do is ensure that your baby's mouth is wide open. And you are the one to bring this baby to the breast. Don't take the breast. I don't know if you can see me because it's getting...
we can see. Yeah.
You can see me?
Yes.
Don't take this breast down to the baby like this. No. You sit properly with your back well positioned, and then when he opens his mouth wide, you bring him into the breast. Now if you hear clicking sound, you take him out. You know what moms do? They're so persistent. They're like, I'm feeling pain, but you know what? I've tried this so many times. Let me just let this baby just be. No, you will do it 10, 15 times. But you've got to be comfortable, because if you're enduring the pain, then imagine it's going to be painful. You'll start to have cracks or nipples, and you're not going to enjoy the journey of breastfeeding. Then another tip for moms with newborns, you know this hold, which is the cradle hold, every mother, this is how all mothers hold their baby.
That's how we've known that's how breastfeeding should be. That's what we've been taught.
Yes. But for moms with newborns, that's not how to hold your small baby. So let me take my small baby here. So this is like a small baby, yeah?
Yeah.
It's very difficult for me to breastfeed her using the cradle hold, which every mother uses. For moms with newborns, 0 to 3 months, you are going to do this. Put your hand in between their legs and hold them that way. So you're supporting their back. You put 4 fingers under the breast and your thumb on top. To know this, you see this one, the cigarette or scissors.
Yeah, ndo tunajua.
Tunajua hii. You're only going to allow the baby to take what's in between, which is just the nipple. So take out your fingers. You're going to have 4 fingers under and the thumb on top. And then wait for her to open wide. So you've seen how your baby opens her mouth wide.
Yeah.
Bring her to the breast. So I'm not going to move. No, I'm going to bring her to the breast like that. Then I'm going to let go slowly and then cradle her. And my palm will hold her bum. And there you go. Okay. But if you're showing a new mother to breastfeed this way, I can imagine it's so hard. So you can do it with the breast or the football hold. For moms with bigger boobs, this way, like where are you in between all this breast tissue? I know.
Yeah.
So do it down the side. For a CS mom or moms with big breasts, this works.
Actually, that's what I found to be most comfortable, like that hold. And the funny thing is, in hospital, when people would, exactly that way. And when people would come and visit me in hospital, people would be like, "Yo, is it this vile unashikanga mtoto?" And then it's like, and then you have to start explaining, no, actually, this is the football hold. And now it can be very frustrating. Now, one thing which you've mentioned is when you want to put, I wish I had my own baby. Can Aramis be my baby? Okay, Aramis is my baby, guys. Okay. So when you want to put the baby on the breast, you said you wait for the baby to open their mouth. But I feel like there are some times that your baby just doesn't do that. Is that like, will all babies do that? Or what if your baby doesn't?
If the baby doesn't, thanks, Joa, that's a fantastic question. What you do is you tickle the nose, the top lip, the bottom lip with your nipple. You just play with it there. So as you play with it there, they will be like, they'll want to bring that thing into their mouth. So then they'll open wide. Because sometimes moms say my baby doesn't open their mouth or their mouth is small. Imagine, even if your nipple is big, it will fit your baby's mouth.
Really?
Because some moms say, oh, my nipple is too big for my baby's mouth. Imagine, no, they'll open.
Really?
So play with the nose, with your nipple, the top lip, bottom lip, and once they open wide, like they're about to yawn, you bring baby to the breast. You
put the baby to the breast. Now let me ask you, is there, because I've seen stories of like women who like their baby is born with something in their mouth. I don't know what it's called, like a tied tongue or tongue tied something, which does not enable the baby to so how do you know when your baby has that? Because if your baby has that will make it like almost impossible for the baby to breastfeed, right?
Yes, it makes it very hard for them to get a proper latch. And the mom will always be complaining of very sore nipples. Yeah. They also have a clicking sound the entire time. So you know what moms can do? You just put your fingers in the baby's mouth and try and lift the tongue. Oh. Now there's if you lift your tongue, all of us, we have a frenulum. There's like a thing that's
Yeah.
That's for the lip, and for the tongue, if you lift the tongue, there's that thing. It extends to the tip for small babies. So the doctor just needs to release it by cutting it. So then the baby can move the tongue and
that sounds painful. Is that painful?
Not for the baby, for the mom.
Oh, yeah.
The mom will feel pain.
I know. Oh my gosh. Okay.
A pediatric dentist can do it, or your ped, if they're comfortable to do it, is fine. In the office, they just take sterile scissors and release the tongue tie. If it's a lip tie, the lip is tied down because of that thing. Release it. But it can make breastfeeding painful. Yeah. And especially if your baby's not gaining weight, they will have to release it.
Exactly. I've seen a lady talking about the fact that she is breastfeeding her child. She says, I feed my baby and majority of the areola goes inside, but my nipple is shaped like a lipstick tip. What can I do?
If the nipple is shaped like a lipstick stick, the latch is not very good. You know how
so that means so they're sucking the nipple.
So the baby is still somewhere, still compressing the nipple. So I'd advise her to change the position of how she's holding her baby. So if she's doing the cradle hold, let her try the football hold and see if the nipple will go further back in the mouth.
Okay. That's a good one. Now, when it comes to challenges, I feel like as a former breastfeeding mom, and also when I had put out questions, a lot of the questions were about getting the baby to latch, and then the second most asked thing is getting your supply up. I feel like one of the things that makes like breastfeeding mothers so uncomfortable is the fact that you don't know how much your baby is drinking. Like, is my baby full? Why is my baby waking up every 1 hour? Maybe they're not getting enough milk. Like, how much milk are they drinking? So
Yes.
can we talk a little bit about that? How do you know when that your baby is actually getting full as a breastfeeding mother?
Super questions. I love your questions, Joanne. Now, one of the things to know your baby is getting enough is their output. You see, this is their diaper.
Yeah.
Okay. How many diapers, wet diapers, are you changing a day? So by the time your baby is 7 days old, wet diapers in 24 hours. Okay.
Yeah.
So that tells you that they're well hydrated. Another thing is that once you've breastfed your baby, they seem calm, they seem happy, and they seem content. And they can at least sleep for 30 minutes to an hour at least. Okay. Then the scales will never lie to you. When you take your baby to the clinic, when they weigh your baby, they'll be like, wow, they've put on weight. Babies put on 20 to 30 grams a day. Okay. Oh, wow. 20 to 30. So in a week is about 140 to 210. So the minimum weight gain for a baby that your doctor will accept is 500 grams minimum per month. Okay. Minimum 500 per month. So you're looking at the wet diapers, you're looking at they're content and happy, you're looking that they're actually adding on the weight. So if these things are not happening, then there's a problem. Another thing, once you breastfeed, you actually feel, I feel so much softer than when I started breastfeeding.
Yeah, exactly.
Okay, being hard, heavy, and full, but then now I feel softer after that session. It means there's been some milk transfer from you to the baby. So the hardest thing is that this is not calibrated, so you can't. There was 250 and baby has drunk 200. But
I know,
Okay, and remember, I've said for a 7-day-old baby, day one, a newborn will only produce 1 wet diaper.
Oh, really?
Day
okay.
2 wet diapers. Okay. Day 3 wet diapers. Day 4 it goes by the age per day. But by day 6 is from 6 to 8. Okay.
6 to 8 wet diapers, yes. Jerry has asked that how many diapers did she say for a day? 6 to 8 wet diapers is what she has said. Yeah. Now, okay, assuming somebody else is asking a question about sore nipples, I think we've talked about that already. If the nipple is sore, that means the latch is shallow. Yes.
If the nipple is sore, it means the latch is shallow. The latch is wrong because breastfeeding shouldn't be painful. It should be an enjoyable, yummy experience between you and your baby. If anything is hurting, there's something wrong. There's something wrong. So try and change the position of the baby or yourself, and also ask for support from a lactation specialist. All right. Then there's also nipple cream. So for moms having sore nipples, where you're having
who is having bad internet. Oh, sorry. Okay.
It had paused. Okay. So if you're having sore nipples, use this. By the way, it has to be 100% lanolin. We're not putting that Aramis you have there in your house. We're not putting the lanolin for pedicures and manicures.
Yeah.
We're putting lanolin, which is so you in between your fingers. You can either and then you apply on your nipple area and the areola area every time you breastfeed, at least for 2 weeks. Okay, so the first thing, you squeeze out breast milk, then you pucker around here. Once it air dries, then the lanolin on top of that. Now the best thing about it, you don't have to wipe off every time your baby needs to feed. I've seen some people asking about that. Like, do you need to wipe it off every time you breastfeed? No, the child can just. Caricho says I used Aramis. If you use Aramis, imagine you have to wipe it off.
Exactly. Why do you want your baby to suck a remis? But let me tell you, you know what I did this time? Because with my second born, when I was trying to breastfeed her, I used to get such bad the nipple cracking. This time, what I did to completely avoid it is whether or not I was having sore nipples, every breastfeeding session, I would put the cream afterwards, like whether or not I have the soreness. And it ensured that I didn't at any point get any, sort of like soreness on my nipples or anything. Now, my next question is this. I feel like many women give up on breastfeeding when they start to encounter like some of these challenges, right? What advice would you give to a woman who's just like she's just had enough of breastfeeding and she just wants to give up? What advice would you give that kind of woman?
First of all, before she gets where she wants to give up, it means she's been struggling a little. If you're struggling, you need to ask and seek out for help. Yeah. Get help. Speak to a lactation specialist. I'm a lactation specialist. There are others.
Yeah.
Speak to us on the phone. We can do a home visit and come and help you. Let me tell you, usually it's such a small thing to change.
Yeah.
Don't you see that? You just need to change the way you're holding the breast, and then it gets better. Other moms also quit because you've gone back to work and you're finding your supply is low. You're not meeting the demand.
Yeah.
You're like, ain't never that serious. Okay. But it helps to plan before and know, okay, when my baby is 4 months, I'll be good. So imagine maybe starting expressing and storing at 2 months.
Yeah.
Or even earlier if possible. Yeah?
Yeah.
So
1 month then. Yeah.
So when you store, you can store in a Ziploc breastfeeding milk bag, or their containers. These ones, moms tend to use them for food. Do you see them being used in church?
Exactly.
For food?
Yes.
Yeah? But they can also be used as breast milk containers. But the more you express and keep, it's like you're tricking your body that you have a twin.
Yes.
So there's the baby, and then the baby has a twin where you're using a pump to express milk. You can even use your hand to express milk. Then you store it, and it can be stored in this bag for 6 months in the freezer.
Okay. Oh, wow.
Yeah.
I love that. Okay.
Just try
someone. Yeah. A lot of the questions are asking about supply. How do I increase my milk supply? Someone says that they have a friend who had traveled and she's come back after 2 months. Is it possible for her to get her supply back? Let's talk a little bit about supply. How do you, well, you've already said about how we know that the supply is enough and the baby is getting full. But if you know your baby is not getting enough milk and you feel like your supply is low, what can a mom do to increase and maintain their supply?
Okay. So 2 things. First is, as long as the latch is good, you have to increase the demand from your breast. So what do? Try to pump. Best time to pump is the middle of the night, early morning. Because when you pump in the middle of the night, the milk producing hormone prolactin is highest at night. So you've gone you've come back after 2 months. What do?
Yeah.
You start increasing your supply by pumping. Even if you pump, okay? So you pump, here's your breast. You've pumped, and imagine you get how many ml? 20.
10.
Do not get carried.
Yeah, it can be really depressing. It can be really depressing. You sat there for 30 minutes and you have 20 ml. By the way,
someone is asking at how many months should baby start drinking water? At 6 months. Okay, let's go back to expressing. So you express, you only get 20. Moms, please don't be discouraged. That's a start.
Exactly.
The next time, imagine you get 25, 30, 40, it will increase. There's a secret to this. Is something called power pumping. Now, power pumping, you're going to pump for a total of 1 hour, but this is what you do. So you pump for 20 minutes, then you rest for 10 minutes. Then you take the pump again, pump for 10. After 10 minutes, you rest for 10. And then finally, you pump for the last 10 minutes. So if you do power pumping for supply that's really low, 3 times a day, your milk will increase.
Yeah.
So please have the power pumping regime. That's going to help increase your milk supply. Then there are certain things you can eat. Okay.
Things like
fenugreek. Moms will feel like they're sweating a bit more. They're smelling of maple syrup, but it works.
Yeah. Oats. I hear oats is also a galactagogue. Is it called galactagogue?
What's that?
Oats.
Yes, oats. And you eat it as a snack. Oats are galactagogues. So I'm talking about galactagogues, and these are things that will increase milk, So there's oats, there's fenugreek, there's moringa, there's linseeds, there's sim.
Yeah. Oh,
It
really?
helps.
What? I didn't know that. I didn't know that.
Let me tell you, it helps. So do
Yeah.
sim. What else? Then now you see lactation cookies, lactation, those muffins. They have those things. They must have oats and they must have brewer's yeast. Brewer's yeast is
that's
like a powder.
yeah.
It can come in powder form. If you're baking, you can use that to bake with. Or it can also come in tablet form. In my time, it was just powder and I used brewer's yeast. It used to work for me. But another thing, imagine people are stressed. People are stressed and anxious and upset.
Yeah.
That will affect your milk supply because breast milk production is from the mind. You need to be calm.
Exactly.
You need to be, confident. I know what I'm doing. I'm sleeping okay, all anxiety. But imagine when you go back to work, there's so much stress. You're waking up early, you're sleep deprived. All those things, other than just the fact that you're not breastfeeding your baby all the time, it will affect your milk supply. Yeah.
Exactly. And then also obviously hydrate, because breast milk is like 90% water, right? So just drink water also. Just drink water. I've seen someone asking, can you restart breastfeeding after stopping for a month? Shira's already said you can. All you need to do is to increase the demand, and then the milk is going to actually come. Someone else is talking about pumping. So she says, how do I pump a lot and I don't have a freezer? Is there any other way I can avoid the milk spoiling?
Okay.
I don't think
so. They have no freezer, but they have a fridge.
Yeah,
I think they have a fridge. The milk can stay there for 3 to 5 days in the fridge.
Oh, nice.
So 3 to 5 days. Yeah, in the fridge.
Yeah.
If let's say I've pumped this just now and I leave it on the counter, it can be there for 8 hours without putting in the fridge or a freezer.
Yes. Okay. Oh, nice. I love that. Yeah. I don't know if we mentioned this, but someone is asking, how soon can I start expressing after baby is born? I'm guessing they mean like expressing for storage. Is there a time limit, or is there how soon would you recommend if they want to increase and maintain their supply?
I would do between 2 and 6 weeks.
Yeah.
Don't wait longer. By 3 months, your milk supply has been established, and your body will know, okay, all we get out of here is a liter, so that's all I'm going to produce. So between 2 and 6 weeks, start to express. Okay.
This one is a good one. I think we can talk about this. She says, hello, my baby is now 3 months and I'm about to resume work. She has refused non-formula completely. What is the other option now that I'm going to work? Can I start her on Cerelac? No. Do not.
I think, I'm speaking to a mom with a 3-year-old who is experiencing chronic constipation.
Oh no.
Since she was 5 months, chronic constipation. Now tell me a 3-month-old.
Oh no, that's horrible. Yeah.
They're 3 years and they still have chronic constipation. So don't, no Cerelac.
Exactly. I would advise you just try, because you've only tried one brand of formula. Sometimes children don't there are very different nuances with the different kinds of formula. My daughter also refused none, and I ended up using Liptomil, and that's the one that she took. So just change the formula that she's taking, but definitely do not start her on any solids until she's 6 months. But people are always trying to win their kids early. Even your grandma, your mother's always huyu mtoto ako na njaa, hashibi. So you're always being encouraged to feed the baby early, which I know is not good for us. It's not good for the baby for sure, right?
Neither do they need water. Months.
Yeah. Oh yeah, neither do they need water. Yeah. Okay, someone is asking about, so assuming you've breastfed your baby, and she says that the baby keeps burping up the milk, how can she differentiate between the baby's vomiting because they're too full vis-a-vis they're just burping up milk? Yeah.
Okay. So the burping out milk is called possetting. So they've burped and a bit of milk comes out. That's because there's a valve in their stomach that hasn't fully developed, and it only closes at 6 months. So if they take more than they need, the air will come out and you'll come out with a bit of milk, usually a teaspoonful or 2. Vomit is the forceful ejection of stomach content. It's you can see the baby is But with possetting, the baby could be smiling, they could be happy, and milk comes out. So what I do is try to elevate that baby a bit more. Okay, ensure that they've burped enough. Keep burping them. And then on their bed, you see how when you visit someone in hospital, their cot is even your baby.
Slightly,
The cot is
yeah.
slightly inclined. I
Yeah.
would do this and some under the mattress so that the baby, whatever is coming up, just comes back down with gravity.
Yeah,
elevate
exactly.
the mattress that it's inclined.
Slightly inclined, yeah. Okay, that's a good one. Okay, someone is asking, any help with a baby with teeth who is starting to bite? Ouch. Ouch. Ouch.
Okay, that's a good one. When babies start to bite, you have to.
My network or yours? Yes, you're back now. You're back now. Yeah. Hello. I can see you, but I'm not hearing you. I can see you, but I'm not hearing you. I can see you, but I'm not hearing you. Guys, can you all hear? Can you all hear her? I'm not hearing you. Hello. 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 Guys, please comment below if you can hear Shiro because I'm not hearing her on my end. Can you hear Shiro? Oh, okay. So they're saying they can hear me, but they can't hear you. They can hear me, but they can't hear you. Hello, hello, hello. Hello. Okay, guys, as they try to reconnect her, I can see a couple of people asking me to talk about why I stopped breastfeeding Mutana. So the reason why I stopped breastfeeding Mutana, which I explained at the beginning of this, is that I went back to work, and when I went back to work, I was really determined to keep pumping so that I can keep breastfeeding her, or that so that she can keep having breast milk when I go to work. But the breastfeeding, the pumping was just too difficult. Like I would go to work and I didn't have time to I didn't have like 30 minutes to go and sit. No, sorry, we still can't hear you. We didn't have time to go. I didn't have time to go and sit and now start trying to pump and what, because I needed to be present at my job. Shiro, say something so I know if I can hear you.
I am here, finally. I'm sorry. Technology.
What happened? What
I
happened?
don't know. It just went off. I stopped hearing you.
Sorry. Okay.
Okay, so what did I miss?
No, I was just basically explaining to the people who kept asking me why did I stop breastfeeding Tana. I was just rehashing my story of why I stopped breastfeeding her and the whole element of going back to work. But yeah, there was something you were explaining before your sound went off.
Yeah, for the baby who is biting the mom. Now finally has teeth. Because sometimes people believe as soon as my baby gets teeth, that means stop breastfeeding. But that's not what it means. Some people get teeth at 4 months, others get teeth at 10 months. It doesn't matter, but their teeth will finally come. If they bite, you exaggerate and make a loud sound or even scream and take the baby off. Okay? So they'll be shocked and they'll cry. And let them cry and see mommy is hurt. And then maybe after 2-3 minutes, put them back. Okay? If they bite again and take them off, then they'll realize biting is not good. Some moms, what they do is flick the cheek. Inflict a pain, I know, and then take the baby. But then you're going to teach the baby that it's not good to bite mommy because it can be really painful where the nipples become really sore and you're not going to be enjoying breastfeeding.
Okay, that was a good question. I've seen a couple of people asking about nipple confusion. So we've talked about pumping. Obviously, if you're pumping, you're putting your breast milk in a bottle, right? And you're feeding the baby from the bottle. But some people have mentioned how sometimes when you start feeding the baby from the bottle, the child gets confused and then now they stop wanting to breastfeed from your boob, because obviously it's a lot easier to get milk from a bottle than it is to get milk from your breast. So how do you ensure that the baby is, able to still continue breastfeeding, but can also be bottle fed? Like that's a whole dynamic that I think a lot of people struggle with as well.
Okay. So baby should not be given the bottle at least minimum 3 weeks old. Okay? 3 weeks old. Any earlier than 3 weeks, it means your baby will definitely get nipple confusion, which means the baby prefers the tip of the bottle to the mom. If you have breast full of milk and you walk around naked bending over, that doesn't mean this nipple will start leaking of milk, okay? But if you have a bottle and you take out the lid, it's gonna definitely remove the lid, it's gonna drip out, okay? The baby gets used to that fast flow. The baby gets used to, it's a lot easier. So 3 weeks is enough time to ensure that breastfeeding is well established. Mommy knows how to hold and position this baby tummy to tummy. The baby knows how much of the breast they need to put in their mouth, how hard they need to work. Because if your breasts are empty, it takes about 45 seconds to 1 minute for the brain to register, there's a baby, let's send it. It needs the hormone oxytocin. Then the baby starts to swallow. Okay. Yeah. But if you give the bottle too early, I've seen 2 moms yesterday, and both moms, both babies have nipple confusion. A 6-day-old.
What?
A 6-day-old.
Too early.
Too early. And the other one will be 2 weeks today. Nipple confusion. Why the moms are struggling, especially moms with large boobs, they get really hard time. Also, those with flat nipples.
Yes, flat nipples.
Or inverted. They're like, the baby is not latching. Where's my nipplet? So I want to show you a gadget that will help you to remove
your flat nipples.
Your flat nipple. Okay. Now in hospital, this is what they give you. They cut the syringe part, and they tell you to put this on your breast and pull.
Yes,
pull, okay, but it's painful. And then you end up getting a friction burn around here. Now, Avent have a nipplet. This one looks like a syringe, but then there's this thing here. You put it on the nipple. You put it on the nipple, you hold it there, and then you pull. So when you pull, it pulls out.
Oh, nice.
It helps and protrude the nipple a bit more. Yes, very cool. Once you do that, then you're able to latch the baby immediately. Okay? And then they latch, because the baby needs to feel something in their mouth. The same way people their thumb, they are massaging over here, but they want to feel this tip inside their mouth.
Yeah, exactly.
So the baby, if you're struggling with flat nipples or inverted nipples, this gadget here is going to help.
Yeah. Okay. I hope people have heard that one. Interestingly, when I had my firstborn and my secondborn, I thought I had flat nipples, but turns out I didn't really, because when the baby would suck, it would come out. So it was just in my mind that I thought I had flat nipples, but actually I didn't. My nipples were just fine. I have some people asking about did I have stored milk when I stopped breastfeeding Tana? Yes, I did have some stored milk, but it ran out pretty quickly. Like it ran out in 2-3 weeks she was done. So yes, she's now.
Where can we get this gadget? Sorry, go ahead.
Yeah, so I was just saying that she's now fully on formula. Yeah, but tell them, where can they get that gadget? And also
they can get it from the mother and baby shop.
Mother baby shop, yes.
Yeah. They're on Instagram and they have this. Okay. Even this breast milk bags that I talked about how to store, you can get them from mother and baby K shop. When you're putting milk, I forgot to mention, when you put the milk in here, it becomes bulky at the bottom. So what I do is seal this and then lay it flat. So when you put it in the freezer, it freezes paper thin and you're able to store more. Okay, as opposed to just a big bulky packet of milk. You store more when you allow it to freeze. This way, this is an Avent storage milk.
An Avent storage,
and you can still get them from mother and baby.
Yeah, I feel like, whenever you're doing such important things, time just ends up going so quickly. Like, I'm shocked at how quickly time is going. So I feel it's 3:47. So I feel like I want to help out as many women who are actually on the live, answer their questions. So let's go through some of the questions. Someone says 32 weeks pregnant, but I'm not leaking yet. Does that mean I won't have a lot of milk supply?
No.
That's a myth, and you need to bust it for us, Shiro.
No, it doesn't mean that.
Yeah.
It doesn't mean that if you're not leaking milk by 32 weeks, you're not going to get milk. No. Wait for the baby to come, then you will get the colostrum, which is thick. Let me show you how thick. It's thick. You only produce 5 to 7 ml of colostrum, and I wanted to show you the size of the baby's stomach. This is what you're going to produce. Okay?
Wow. Yeah.
5 to 7 ml, and it's enough for the baby.
Yeah.
It's enough for the baby to have from day 1 and day 2. Then after that, it goes increasing to about 30 ml by day 4.
Yeah.
What moms believe is as soon as they give birth, they're going to fill a full glass of milk with their milk. No,
exactly.
It's really little.
Exactly. That's a good. I think those are some of the things which probably this person has been in like a group with moms, and they're like, hey, but then me at 30 weeks, my boobs are leaking, and which usually happens like to moms who I guess it's like your third time or even second, third time mom that will happen to you. Because with my third pregnancy, that happened to me, but with my first one, I didn't get anything until the baby was actually born. So don't worry that you're not leaking milk. You will still have supply. Someone is asking a question which is making me laugh. She's like, my baby is 2 years and 5 months and has completely refused to breastfeed. What should I do? Let it go, sis. 2 years, 5 months. I think he's done.
Yeah.
I think he's done. I think you can just let the child. I think they're done. Someone is asking a question about weaning. We are not talking about weaning in this one, but guys, we're gonna have more lives. So for this one, we're just only talking about breastfeeding. Someone else is asking about. Okay, we have already mentioned where we can get the gadget. Let's see what other questions. How do you educate? Okay, assuming you're pumping milk and you're storing it, how do you educate your nannies on how to warm the milk? So let's talk about like feeding the baby the milk from the bottle. How do you warm that milk?
Okay, so the milk has been in the freezer.
Yeah.
So you're gonna take it out, and usually it thaws really quickly. Within 20 or 30 minutes, it thaws and becomes really quick. Yeah. Then you take it out from here.
Yeah.
And put it in a container. So imagine you're putting in a container, and then in that container, you put the milk in here. Then you put it in a bowl.
Yeah.
Of hot water. Now the water shouldn't be so hot that if you put your hand in, you're gonna burn.
Yeah.
It should be hot but not boiling. So if it's boiling from the kettle, reduce it with some cool it with some cold water.
Yeah.
Within 5 minutes, it should warm. When breast milk warms, you'll see 2 layers. There'll be a layer of fatty foremilk, and then the watery of milk, which is the hind milk. Okay.
Yeah.
Now, what we don't do is we don't shake.
Yeah.
We don't shake breast milk. What you do is you swirl it like a glass of wine, or you stir, because it's said that there's some protein molecules that you break down and destroy by shaking.
Yeah.
But I don't want moms to feel, oh my God, I've been shaking breast milk all this time, so now I'll be giving my baby.
Exactly.
Okay. So once you do that, then you can test the temperature at the back of your wrist or at the front. If it feels hot, it's too hot. It should just feel right and comfortable.
Okay.
And then you offer it to the baby.
Yeah. So what Shiro
we don't use the microwave.
Yeah.
And we don't use the sufuria. The only time you use the sufuria is for HIV positive moms, where you've got to scald the milk, like boil it and then immediately cool it.
Oh, okay, fine. Oh, that's useful information. Okay, guys, so you had so now this lady was asking, how do you tell your nannies? Describe to your nannies exactly what you've been doing, or better yet, let them watch you do it so that they can know what to do when you're not around, because that's the most important thing. A lady here, Sly Masara, is asking, my baby has completely refused the bottle and I am about to go to work. He is 4 months old. What method can I use to train him so that he can keep feeding him the breast milk even when she's not there?
He's refused the bottle?
Yeah.
And use a cup or a spoon.
Can use a cup, okay.
Yeah. Sometimes it's to try different brands and see if they'll accept them. If not, just use a cup and a spoon, or a spoon.
Yeah, okay. I feel that's an important one. Although I always wonder, you know how people always like, oh, my baby has refused this, my baby has refused this. I'm just like, how can a baby refuse? Like, they don't have knowledge of the world to be able to like agree or refuse stuff. I feel like,
but they have a preference.
But I feel like if a child, for example, try to give the child the bottle and they refuse the bottle, but then now after they have been refusing and they cry, you give them the breast, then they learn that if I cry, mom is just gonna give me the breast, you see. So then I know that I don't have to have the bottle. So sometimes I feel like a little bit of persistence can help you be able to, be able to get the baby to do what you need them to do. I've just seen a question which was important. Okay, someone is asking about pacifiers. Can pacifiers be a hindrance to effective breastfeeding?
Yes.
Yeah.
Okay.
Okay. So you'd not recommend? Mm-hmm.
Yeah. Well, it's an emotive issue. By the time
For
my
me,
mom
it's
is
very
deciding,
emotive. For me, it's very emotive because I've used pacifier from day one. Shiro, day one.
And she was okay with breastfeeding.
And she was okay with breastfeeding, by the way. She was very fine.
Yeah.
I think it also depends on the kind of pacifier that you use, because the ones we used were the ones from Avent, called Avent Suthi. So they look very much like a nipple. So she didn't get confused. If you use those other ones, which are like almost like flat topped, then it's like very different from like the way a nipple looks, and then she would get confused. But with the Avent Suthis, she was pretty okay.
Okay. And you didn't, sometimes moms end up using them for so long, the baby starts to cry and it pops out. And you think, they're crying because it come out.
Yeah.
You pull it, pop it back in. But then it's actually the baby saying, I'm hungry.
Yeah.
I'm hungry, and I'm communicating that I'm hungry. But then you end up missing the feeds, so it decreases your milk supply.
Oh, yeah. Okay.
At the same time, in terms of hygiene, you've got to be careful. If it falls, some moms are, I hope you're not one of those.
Exactly. I'm not
or wiping
one of those.
yourself and pop it back.
Let me tell you what may do. I have like literally 20 soothers or more in my house. So if one falls, there's another one here already waiting. If we're leaving it to go to church, in the bag I've packed like 10 of them. So I can never be caught without one, which is one. Hey, yeah, me, that's not my struggle. There's someone who's asked about breasts being engorged. So you know how you mentioned about when you're breastfeeding, you put the baby on the boob and then afterwards you feel like, okay, it's a bit lighter. Now she's asking, do my breasts have to be engorged for me to know that I have enough milk? Because her breasts feel a bit flaccid. So does that mean that she doesn't have enough milk? Yeah, tell us about that.
No, and that's a myth. People believe that once I feel full and heavy, it means to have milk. Even when they feel flat and soft, the milk is still there. The milk never issues completely. Even if you've not breastfed for 2 weeks, okay? Put your baby on the breast. Even if they feel soft, breast milk production takes place real time. Like, put the baby on the breast. There's a hormone that talks to the brain and says, hey, there's a baby. Then milk will be released. So it shouldn't be that, okay, fine, I've touched myself. I feel soft. Okay, fine, let's use something else to feed the baby. No, put the baby on the breast. The baby will get the milk.
Okay. Someone else is talking about she pumped some milk during the first week for her baby and she froze it, I believe, and it's fully colostrum. So she's asking, is it safe for her to still give that milk to the baby now? It's been months.
Yes. Colostrum is full of antibodies. It's full of immunity fighting properties. So I'd actually mix it in bottles of milk. If she has a lot, just mix it with some of the milk and let the baby take it. It shouldn't go to waste.
It shouldn't go to breast milk is precious.
Liquid gold.
I never forget a time I pumped milk and then I came and found that my nanny had poured it. I almost, by the way, that day, I would have been in prison right now. Let's just say I would have been in prison. All right. Someone is saying that her baby is 5 months old and her supply is a lot. So because she's expressing and she's also breastfeeding the baby at the same time, she feels like she can't leave the house even for a few hours because her breast will be so full. So she's asking, should she stop expressing so that she can sort of lower her supply a little bit and then have a bit more freedom? Would you recommend that?
I'd actually recommend, if she's expressing too much, she can reduce the number of times she's expressing, because it sounds having an overproduction and oversupply of milk.
Yeah. And it's so interesting, like as I read that, it's so interesting how different people have so many different struggles when it comes to breastfeeding. You know, someone is too much, someone is too little, someone, the latch is perfect, someone is, there's such a myriad of things. But guys, that's why people like Shiro exist. So if you want like individualized consultation, please, can you DM her after this and she can give you her charges. Someone is asking, let's see, no, I think that one we've already talked about. We've already talked about sore nipples. We said the baby is not latching properly and you can use a nipple Shield. Yeah, we said nipple shield. Do you talk about nipple shields? No, we talked
We
about
didn't.
nipple
And I
cream.
think, no, not yet.
Tell us a little
Nipple
bit about
shield.
nipple shields. Yeah.
So these are, okay, I'm not a fan of them, but for moms with serious nipple confusion who still want to breastfeed,
Mm-hmm.
let me get it off, who have nipple confusion, they've tried to reverse the confusion, it's not working. The nipple shield will be able to help her to breastfeed directly. Okay, so this is a nipple shield. This is an Avent brand. I think baby mother and baby shop store them. So this is what you do. You fold it kidogo, okay, and then you put it, and then it should attach, okay, and stick
Just
to your breast.
Yeah.
Okay, so then the baby thinks this is the teat of the bottle, but it's actually your breast.
It's actually your boob.
So
Okay.
moms are struggling. For me, I usually say use it for 3 days, and half the time you remove, try and latch and see if they'll accept. They refuse, put back. But if your baby seriously has nipple confusion, use this. This is also used for moms with very, very sore, cracked, bleeding nipples that you want to give your nipples a break because of how tender they are. This helps just for 3 days, and you should be good. Okay, so this you can also get at the mother and baby store. It's also used for moms with flat or inverted nipples. But for me, I usually show you how to hold the breast because it's possible to breastfeed with flat nipples, and eventually they pop out. If they're not popping, try and use this before you go to the shields. Try and use this nipple.
All right. Yeah. There's something I want us to talk about because I'm seeing too many of these questions. There's a lady who's asking, can I give my baby porridge at 3 months? There's someone else who says, can I introduce fresh milk to my 2 months baby? No, guys, it is recommended that the baby only has milk until they are 6 months old. But you know what, Shiro? One thing that people don't talk about often is that obviously we would all have loved to breastfeed and we would love that be able to breastfeed until 6 months. But some people are just not able to do that. And for those who are fortunate enough and can afford formula, because formula is expensive and babies go through formula like really, really fast. Some people can afford it, some people can't. Assuming you're not able to breastfeed and you can't afford formula, what are like the next best options for you in terms of giving the baby the nutrition that they need?
You can do the modified milk formula at home. This is by mixing normal milk with a bit of water. There's a teaspoon of sugar or something, depending on the quantity, to make your own homemade formula at home. You can't give Yani cow milk straight as it is. There's issues of lactose intolerance, there's allergies, there's asthma, there's eczema, all those things. If you can, try to avoid it, do breast milk and do formula. But if you can't, either because of an economic issue, you can't afford the formula, then you can make it at home.
Yeah. Okay. Someone else is asking, is it okay? Is it normal to have high supply of milk on one breast and not on the other? And what can they do to address that if it's something that needs addressing even?
Yeah, because it usually happens because you have a side preference.
Yeah.
You tend to feed that baby on a particular side. Most times moms feed more on the left breast.
Yeah, it's just comfortable.
Even for you.
Yeah, it's just the most comfortable. It's just like it comes so naturally. Yeah.
Yeah. Yes, and babies somehow tend to prefer the left. By the way, I think it's because they hear the heartbeat. They hear the mom's
maybe. And they feel like we're inside again. It's like we're inside her.
Yeah. So they also have a preference. And most times babies with a preference to a breast, it's usually the left side. She needs to balance. If you're breastfeeding more on this side, try and always do the other side once you finish the breast. I want to say this before we end. I want you to go like my Nurturing Moms page on Instagram. And on Facebook, I have put a link to a breastfeeding mastery, key tips on breastfeeding. Most of which I've spoken about here, but if you want to read it and internalize and get it, you'll get it on my Facebook page, Nurturing Moms. It's MOMS, moms with an O.
Moms, that is very Maju. Why would you name the moms with that? Oh, Mom. So bougie. Like, God, guys, let me tell you, I wish we could go on and on and on and clearly, like an hour. How does an hour go by so fast? That's crazy. Someone is asking, please save this live so they can have it for future reference. I believe Mother Baby KE is going to save it on their page as an IGTV video so that you can be able to refer to it. But also, Nurturing Moms has so much information and so much, like, resources about breastfeeding. And if you can't find what you need there, you can always be able to reach out to her for a consultation. So many questions about breastfeeding. My God, so many. Like, I wish we could get to all of them, guys. We are so sorry that we can't, but I hope that you've learned something. I know I have learned a lot. Like, if I was to have another child, I would definitely attempt to breastfeed for longer. But, you know, I do not intend to have any more children. I have no intentions of having any more children. Do you intend to have any more children, Shiro, so you can breastfeed them?
I wouldn't mind.
Oh my God. No. Me, I'm just
There's
too
a
much.
hamper to be given.
Mm.
I think you're going to ask somebody a question. There's let me have this. Lactacare cookies. And
Oh, okay. Oh, a giveaway.
Avent storage bags. Up for grabs for milk storage bag. And then are you seeing the size of these cookies?
Those muffins. Hey, those muffins, by the way, I ate so many of them in the past 2 months. They were so good. They are so good.
Yeah. And then there are cookies here from Lactacare Kenya.
Yummy.
And they're huge. Okay.
Okay,
so
since you're done who has been giving us the information, you ask somebody a question so that we can see who has been listening, who has been learning.
I ask? Okay. Now, what can I ask? What is the product that will help moms with their flat or inverted nipples?
That's a good one.
Talk about that.
What is the product? Okay, even me. Ladies,
so
the
go
first
to the
one.
last post from Mother Baby KE, and they can put their answers there. And then Mother Baby KE will pick the winner.
Pick a winner. Okay, guys. So that was the question. The question is, what is the product that Nipple Shield is not the answer. Let me already help you. Nipple Shield is not the answer. But
question number 2. Question number 2. If your baby is 2 days old, how many wet diapers should they get? Your baby is 2 days old. How many wet diapers should you expect to get from a 2-day-old baby? Wet diapers, not poop, pee. How much? How many?
Oh man, wait, Shiro, you're making it hard for guys, Maze. Even me, I'm just like, I need to go and Google something. So guys, make sure you have make sure you have followed the Mother Baby KE page. Make sure you have followed Shiro Shera Dula page, Nurturing Moms page. Obviously, I hope you're following Yummy Mommy's page already. We are so glad that we were able to give you all this information. Philips page as well. Do they have a Kenya specific page, or is it just the international one?
Philips Kenya.
Philips Kenya. Okay, guys. So follow Philips Kenya as well. And we will be back. I believe we will be back here, or at least I will be back here next week for another session about more information that you obviously need for your baby. Thanks, guys, for joining. We appreciate you all. Thank you so much.
Thank you. We thank also Mother Baby. We thank Avent. And thank you, Yummy Mommy. You've done an amazing job.
Thank you. So nice to see you. I hope I see you again in person soon.
Yeah, God willing. Thank you so much.
All right.
Bye, guys.
Bye.